Assalamu alaikum, everyone. I'm Dr. Habib Haider, consultant acute medicine and educational lead of APNE. Today, we are doing a very important session on CV building, which is a part of APNE Medical Masterclass. I'm extremely grateful to young doctors, especially Dr. Hassan Mirza and Dr. Kawal Jain, who came forward and agreed to help us to moderate this session. And thank you to Mr. Wright as a colleague and also college fellow to come forward to give his expert opinion. Last but not the least, Dr. Shanur Tarek for coming forward to give his expert opinion regarding CV building. And once again, thank you to Dr. Nadeem Sajad Raja, General Secretary of APNE, who took this initiative and decided to promote these type of session for junior doctors. And without a delay, I'm going to hand over to Dr. Hassan Mirza to take this session forward. Thank you, Hassan, once again to come forward and help us during this session.
Hello, Assalamu alaikum. Can you hear me?
We can hear you.
Yeah. Hello, Assalamu alaikum, everyone. I'm Dr. Hassan Mirza. I'm the APNI lead for London and the south of England. I'm very thankful to the APNI leadership, especially to the General Secretary, Dr. Raja Nadeem Sajad, and the APNI education lead for providing us this great opportunity to get together and to provide a lot of information to the new and upcoming budding doctors. Myself, I'm a dermatology registrar working in London, in Royal Free London. It's one of the most prestigious organizations in the country to work for. And I'm very thankful again for the guidance provided by the APNI seniors, especially Dr. Raja Nadeem Sajad and the education lead to guide me to get me where I am right now. APNI, speaking about APNI is the largest organization of the doctors in UK, of Pakistani doctors in UK. We are going towards becoming as large as Association of Pakistani Physicians of Northern America, as APNI. So our aim is to become a primary representative body of not only the doctors, but also the Pakistani diaspora, mainly in the Europe and in the UK. Like APNA is the primary representative body of the Pakistani diaspora in the United States. They are the major opinion makers. They decide upon, they speak with the senators, they sit with the senators, and they can make things happen in Pakistan. And we have seen in recent past, that Dr. Raja Nadeem Sajad has given a brilliant statement on what has happened in Pakistan, and his statement was taken by the Pakistani community and with great regards. We have continuously conducted educational meetings, and along with that, we have a lot of social gatherings as well. With that, I would like to say that APNI is a democratic organization. That's very important for us to disseminate to our upcoming members and people who are not the members of the APNI, because this is the only democratic organization. You become part of APNI, and people, the organization takes you up to the higher ranks. With that, I'm very thankful to everyone again for joining, and I'll hand this over to Dr. Kawal Javed. Thank you very much.
Hello, assalamu alaikum, everybody. I'm Kawal. I'm one of the doctors working in Belfast, UK, and I'm one of the pediatric trainees in Belfast. I've taken this opportunity today to help moderate this session of APNA. So topic of today, basically, is CV writing and portfolio building. So you know yourself that CV could be a couple of pages, but what matters is the quality of CV, and that's exactly what we're going to talk about today. So we have two speakers for today, Dr. Shanur Tarek and Dr. Naseem Wright. Before that, I'll just let you know that during the session. If you have any questions, you can put it down in the comment box and we'll be able to answer towards the end of the session. In case there are a lot of questions we are not able to answer during the session, because I suppose because of lack of time, we will be able to answer you later. So just a little bit introduction about our speakers for today without any further delay. So Dr. Shahnur Tariq, he's a graduate from King Edward Medical College. He's a respiratory and general internal medicine consultant in Prince Charles Hospital, South Wales. He's very passionate about medical education, and he's also an honorary senior lecturer in Cardiff University. Dr. Naseem Barait, he's a consultant colorectal and general surgeon also, and he conducts CT interviews and ST3 surgical interviews. So I suppose these two people are the best people to talk about the talk of today. So without any further delay, I'll leave it with Dr. Shahnur Tariq to please start with the topic of today. Dr. Shahnur, thank you.
Assalamu alaikum, everybody. Can you hear me?
Yes, we can.
Thank you very much. First of all, I just want to thank APNE for giving me this opportunity to present, and thank you to Nadeem Bhai and all the other colleagues for being so proactive. I've been in UK for a while, and for my personal experience, APNE is one of the like a team of all the doctors who are proactive in helping all doctors on all the platforms. So thank you for them. So I'll just start the presentation now. So it's basically targeted as a junior doctors. And can you see the presentation?
Yes, we can see your presentation.
Yeah. So it's basically on the CV writing and how to build up the portfolio. So why did I went or choose that topic? It's because since being in UK and going through different stages of my career progression, the CV keeps on evolving accordingly. And also when you start your career in UK and you're applying for different specialties like medicine, surgery, peds, gynae, dermatology, or whatever, you have to change your CV or make it according to that. So it's more appealable. And when you apply, there are more chances of you to getting shortlisted. And second part, which I touch on, is how to build a portfolio. Working with a lot of international medical graduates, what I found is that once you start a job in NHS, working back home also, we don't realize that apart from getting clinical experience, there are other things which have to build up into your CV profile to give you better chances of securing the further jobs as you progress in your career. So that's why the title is CV writing and how to build up on the portfolio. So what is CV? So if you look at this meaning of CV, it's basically curriculum vitae is from Latin, which means course of one's life. So it's basically how you present yourself on paper. It is your skills, your work experience, your achievements, your qualifications, and about yourself. And that's the most important part to keep in mind. It's how you want the other person to see you, because if you look at the CV thing, it's the first introduction to employer. Even before they meet you, they get to know you from the paper. So the stronger the CV, the better chances of you getting shortlisting and getting to the next stage of interview and then getting the job and for on. So that's why I think the CV is the most important part, and that's why I chose this topic. So when you look at the CV, there are certain contents which have to be there. So your personal information, the personal statement, which I'll touch in my presentation, your qualification and how they make you suitable for the job that you've applied for, your clinical experience, and also career progression. So like if somebody has done house job back home and they've done like if coming from Pakistan, they've done a specialization like FCPS, then how you progress in your career, that should be highlighted in your CV in the way that it's easy for the person whom is looking at your CV can appreciate that. Then the courses, again, I'll touch into that, how you can present your courses. Teaching experience is very important because in UK, being a teacher, and we all do it either consciously or subconsciously. Some people, they do the formal teachings. So how you present your teaching experiences in the CV presentations, because that's the part of your portfolio building, poster, and if you've done any publications, because they all have ratings when you apply for the jobs, audits and quality improvement projects. Again, these are certain things which a lot of us, like especially myself, when I came to UK, I didn't know anything about the audits. And that's the one thing that I learned as I progress in my career, and now quality improvement projects, leadership and management, because we are all managers as we go up on the ladder. And what of the leadership roles that we have taken up, and any managerial skills that we have done, extracurricular activities, because it's not about being a doctor, it's an all-rounder personality, and what you do out of work is also important, and it also shows different characteristics of your own personality, and then the referees in the end. So I'll touch on, start with all these contents. What I've done is that I've divided into two groups, candidate 1 and candidate 2, and as we go through the presentation, we will look into what's the difference in the candidate 1 and candidate 2, and how does it look like to a manager or a consultant who is doing the shortlisting procedure. So that's the candidate 1. They give their personal information, quite a detailed one. Name, their age, their gender, nationality, religion, home address in UK, marital status, and contact number in Pakistan. So if when you look at this sort of personal information, looking at it, it gives you a lot of information about the person, and a lot of things are there. And the candidate 2, as compared to candidate 1, the candidate 2 has not given that detailed information. However, if you look at candidate 2 personal information, that's more informative for the manager or the consultant. It gives you their name, their contact number, both if they're in UK or if they're in Pakistan. It gives the email address for them to contact, which was missing in the candidate 1. And then it also gives them the GMC or General Dental Council number, which shows them that they are registered with the GMC. And so that gives them the added information. So what I wanted to come from this slide is that sometimes less is more. So if you are doing your personal information, look from the wider end at what would be more important for the managers or the person that you are or employer, and how they can get more information, like your gender, nationality, religion might not be of any extra benefit to them, and home address in Pakistan again might not be any benefit for them if you're applying in UK. So these sort of things we have to keep in mind. So it's not coding everything on the paper, it's what will be beneficial for you and what will be easier for them to give you chances of securing the interview and hopefully the job in the future. Next thing is the qualification. So when you apply for a job in UK, everybody would have done MBBS. Some people have done MRCP and BLAB and things. So how you put it again on the paper. So candidate 1 has done MRCP UK. No offense to surgeons, because I am medic, so that I put MRCP UK, but you can put MRCS or FRCS. They've done PLAB, and in IELTS they've done really well, and they're proud of it. So they have put 7.5 in reading, writing, speaking, and listening 8. They've done MBBS. And then they have also put some extra information on higher secondary school certification and secondary school certification. So if I'm looking at this CV, I would think, good, they've done MRCP, PLAB and IELTS, right, okay. And this IELTS reading, writing, maybe it doesn't make any sense to me what 7.5 means, to be honest. And then if I am a graduate from UK or have done all the way higher secondary school certification or secondary school certification doesn't mean anything to me. HSSC, higher secondary school is equivalent to A levels and secondary school is equivalent to O levels. But is that information required? The candidate 2 has put MRCP UK and MBBS. For me, that's much more cleaner. Give me straight away information that they've done MBBS and then they decided which career pathway they want to go. And in the meanwhile, they have pursued towards getting membership of UK. So again, you can see the candidate 2 has put in less information, but much more informative. If they've done MRCP UK and they're applying for the job in UK, they're registered with GMC, they give me information that they have done PLAB, they're registered with GMC, and now they're applying for the further training in UK. So that's the main thing that you have to keep in mind when you're applying for the job, what you want the other person to look at, and make sure that they're not missing any important information. And now we come to clinical experience. When I did my house job in Pakistan, it was six months in medicine and surgery. Now they follow sort of foundation program thing, like they do 4 months in different specialties during your house job. So the candidate one have done foundation year one equivalent, is doing foundation year one equivalent in urology, and they have done the post in geriatrics. That was the old system, and they've done sort of six months. So they have written a good sort of portfolio of what they have done in the clinical experience. They've done foundation year one rotation in urology, involved in ward rounds, carrying out the jobs from ward rounds, also 1 in 7 general surgical on-call rota. And then in geriatric, they were doing again the ward round with the consultant twice weekly, and it gave them a broader experience of general medical patients, but also on complex stroke patients. Yeah, good enough. It gives you information that they have got a bit of wider experience. Now look at what the candidate 2 might have written. So that's a candidate 2. So they have put their foundation year post together, both the urology and geriatrics, and then they have used the bullet points. So that, looking at in the first side, it gives me that they're much more, a bit cleaner and more smarter way. They've put it organized and supported the ward rounds, gained a broader experience of clinical presentation, both in medical and surgery, developed competencies in management of complex stroke patients and patients with urological emergencies like hematuria. So they have, and then in the end, they have mentioned also their on calls, 1 in 7 and 1 in 8. Other thing which they've added, that they put in non-selected on call, which gives me an idea they have a broader experience. If they're doing in surgery, they were covering general surgical patients and orthopedic patients also. And they have gained the confidence in managing the acutely unwell patients. So if I was shortlisting these candidates, candidate 2 is more appealing to me because they have shown their organization skills, that they organized the ward down for the consultant. They are part of the team, so they have their team working and they gel up well with the team. They have reflected on what they have done during their foundation year program and how they have progressed from being a medical student to their F1 completion. And they also have been more specific and they're more realistic. So I think somebody's mic is on.
I would request if everybody can please mute. Thank you.
Dr. Shanur, you can unmute yourself.
Yeah. Can you hear me now? Can you hear me?
Yes, we can, Dr. Shanur.
Right. And then on the courses, people, when I'm speaking to international medical graduates, they've done the courses back home, like ALS, BLS, and other courses. So yeah, they're very important when you're writing your CV, because that will tell the employer or the shortlister what other things that you have done outside your working. So candidate 1 have done advanced life support. They've done clinical radiology course. They've done the critically ill medical patient course, good clinical practice course, leadership skills, medical law, team working, time management. So if I look at this one, they have done the clinical courses and all of them. So it looks good. So it's in, they've done 1, 2, 3, 4, 5, 7 courses. Can candidate 2 can do better than that? Let's have a look. So candidate 2 has presented the same courses, but they have divided them into clinical, research course, and managerial/leadership courses. So if I look at the CV, that is a better way to present, because if I'm doing the rating of the CV, I know that they have done clinical courses, tick box for that. They have done the research course, tick for that, and they have also done management and leadership courses. So it's the way you present yourself. It takes the same space on the CV. It doesn't increase it to a lot of pages, but it gives better information to the employer or the person who they're shortlisting, and make better chances for the person to be shortlisted if you make it easy for them to analyze how you are presenting and how do you have done the courses for yourself. Okay. Now the teaching experience. We all write that we have done the bedside teaching for the medical students, and then we are very keen teachers and this and that, which we all are. And as we progress, we do the teaching. So has the candidate one. They have been involved in teaching the medical students during rotation to the medical wards, and they've also given the lecture to the 50 medical students on breathless patients. Again, a breathless patient because I'm a respiratory consultant, so that's the first thing comes to my mind. So yeah, so they've done the teaching for that. And also they have given a talk to the patient group in the pulmonary rehab. So it's a good part of the CV and the teaching experience because it's broader. They've done it to the medical students and also to the pulmonary rehab group. We would have realized that the candidate 2 is doing better. So just see if we can do better on the teaching experiences also. So candidate 2 has put in the teaching system examination to fourth-year medical students, ad hoc teaching. So they have mentioned that they have done what examination, and it was an ad hoc mode of teaching that they've done for the medical students. Then they, carrying on, they said that they have lectured to the final year medical student on assessment of breathless patient. It was a formal teaching for the university, and that's give me more information. All right, so they have been involved in both ad hoc and formal teaching. And for the pulmonary rehab group, they have mentioned that they have done COPD and pulmonary rehabilitation discussion, for which was interactive health management teaching session for the service users of pulmonary rehab group. So what does it tell about me about candidate 2? A, it tells me that they have the knowledge of different teaching modes, formal/informal, lecture-based versus in a small group meeting. Secondly, they're adaptable. So in their teaching sessions, they have shown the adaptability moving from medical students / junior medical doctors to a patient group. So it shows adaptability even in their teaching. So this slide has not even showed me that they have experience in teaching, but also that they can change themselves according to the teaching style. They can change the teaching style depending on the user, and they can move from one to another group very easily. So again, that's what should come out of your CV, that all the important information should come to the person who is shortlisting you. Now we come to presentations. We all have done different presentations in our career, and we do it in our general clubs every week, or you have done back in Pakistan when you were in final years or in your house job and things. And again, it's very important because it not only gives the information to the person who is shortlisting you that you have good presentation skills, but also that you again go outside your clinical work and try to improve your portfolio, and you want to keep up to date with the evidence-based medicine, and also want to know what's happening new and what innovations have been involved. So candidate 1, again, is for the surgical and other colleagues. It's basically respiratory-based presentations. So management of pneumothorax, obesity, how that was good became ugly, coils causing turmoil, and malignant mesothelioma. It was a service review. So it gives you information. Yeah, so they have been quite active in doing the presentation. They have touched into the new guidelines by BTS and NICE on pneumothorax. They have looked at malignant mesothelioma and the medical thoracoscopy and review of their services, how they can improve. So they are involved in patient care and how they can improve the patient care. Can it be presented in a better way? Let's have a look. So the candidate 2 has presented the same presentations, but they are divided into local meetings, regional, national, international meetings. So that gives me more information when I look at these presentations, like they have presented in their local general clubs on pneumothorax and coils, and also they have explored other venues where they can share their experience or their information or their knowledge with a wider group. So they have gone to the regional general internal medicine meeting and also in the plural seminar meeting. So it gives me an idea, not only that they are involved in presentation, they are involved in getting an evidence-based, but also they look at how they can share it with a wider group of the people and going for national, international, even regional meetings. So you can see that the same information between the two candidates, how it can put one stronger than the other, just by making it easier for the third person who is looking at your CV to understand and have a better picture of you as a person and also how you're engaged in these presentations. Now, poster and publications. So I always encourage all my junior colleagues that if you've done any work, try to present in a poster publication, or if you've seen an interesting case in the BMJ case report or wherever, because that has got more weightage. So that's what candidate one has done. They have done according to them, they have done a poster or publication on the drugs that act on respiratory tract. They've done something on VIP, virtual important patient, red carpet treatment for the patients, and there's more to disease than what we can learn from our textbooks. So good. So they have done some publications and they've done some poster work. However, the candidate 2 now has come up with a journal, article, poster presentation, and journal. So it gives you more information for candidate 2, where they have submitted these presentations, like the drug that act on respiratory tract. They've given the general name, their volume, and their contribution. Again, the poster presentation. It was not in Cannes Festival, but for this presentation. So they've done the VIP presentation on the patient's care, and again on the disease that works. So again, when you're writing any publication or poster, write in that way. So it's more appealing to the eyes. It gives more information, and it tells where you are with the publications and which journals you have done the presentation. Now the audit. The clinical audit, as I said, is the part of clinical governance, and it's part of our daily working. So how we can improve the care for our patients, and how we can improve so we can reach the standards set by the NICE or our regulatory bodies. So candidate 1 has done quite a few audits. They've done the board round, which is an effective way to maintain the continuity of the care. They've done audit on the pleural disease clinics, and also on prescribing oxygen in acute settings. Oxygen has always been a problem for respiratory trainees, respiratory consultant, always highlighting the oxygen and when to go in with the range prescribed. So good. So they have done 3 audits in a short period, which show that they are involved in improving the care for the patient and their patient safety. Can they have presented it better? So candidate 2 has presented the same audits, but they also given the involvement in the audits. They have also mentioned that they have completed the audit cycle, so they understand the audit cycle, and they've also given it the result. So if I'm looking at the candidate 2 CV, I would have more information on what the involvement was, how the data was collected, and how that improved the care or the service in their specialty. So the candidate 2 has provided their role. They understand the audit cycle. So it not only gives me the information, they have done the clinical audits, but also the understanding of the audit cycle and understanding of their role when they're doing the audit. Extracurricular activities. Extracurricular activities in the CV is important because, as I mentioned before, we are all human beings, and we have our life outside the work, and that's where extracurricular activities come in, how you spend your time after work or after on calls. And that can give more information about yourself, in that you have an all-rounder personality, or you have interest outside medicine, and they might be your individuality or the USP, like if you might be the captain of the cricket team in South Wales, or any group, or maybe the leader of the rowing club in Wye Valley. And it might also demonstrate your leadership qualities and teamwork. So it's not mentioning like that what you do outside, but it also gives more information to the person who is shortlisting you to have an idea about what skills you have outside the work, and what sort of personality you might have even before knowing you personally or having the face-to-face discussion in the interviews. William Moster, who is the father of the modern medicine, many years ago said that young doctors should look about early for an avocation, a pastime that will take him away from patient pills and potions. And that's for our own well-being, and also to be that we are human beings and we have our own life outside work also. Now I come to the personal statement. Now, personal statement is like if you are a salesman, and that's how you sell your product. In this case, you are the product and you're selling to the person where you're applying for the post. So personal statements, it should have a, as the title says, have a personal touch. It's about you and what you want them to know about yourself and how would you be suited for the job that you have applied for. So that's what the personal statement when applying for Foundation Year 2 training, from Foundation Year 2 to CT at that time and IMT. So basically you are mainly highlighting the skills that you have gained in Foundation Year and how they make you equipped to further pursue your career in medicine or whichever specialty you want to. The main thing is the personal statement should change with what job you're applying for. So if I'm applying for a job in asthma, or as a registrar or research for an asthma, it should be more towards asthma and how I would be helpful or valuable for the research purpose, or as a registrar or a consultant lead for asthma in that group. And again, if I'm applying for my career in teaching, it should be different from that one. So it should highlight how I can improve the teaching skills and how would I be more suited for this post. So that's the more important part of this, is that it's all in the personal statement, and that's the part which comes after your personal information, and that's the punchline which makes you sell yourself. What I want to tell all the junior doctors, because sometimes we get frustrated applying for 200 jobs, 300 jobs, medicine, surgery, A&E. Please don't get disappointed. Don't get depressed with it. You will get a job. Secondly, when you're applying, please change your personal statement. Don't just copy paste from one to another. You can always keep the main gist of the statement the same, but if you are applying for surgical post and you say you want to pursue your career in medicine, that doesn't look good when somebody is shortlisting you, because then it does come to their mind that maybe you're copy and pasted the same personal statement for all the applications that you have applied for. So just have a read through it, just to make sure you make the exact changes in the personal statement as required for the job that you applied for. So now the tips on the portfolio building. So that's the one that I wanted to touch on that, because as I said before, when we get comfortable in our teaching, in our training, and get clinical experience. And again, the candidate one had done the IMT, which is the into the core training for medicine, and they've done the core surgical training. They've done the membership exams, they've done the teaching session, and they completed an audit. So when they're applying for the specialty training job, fine, they tick all the boxes, which is the essential criteria for that, but how they can improve it further. So that's what candidate 2 has done. So they have shown that they've done their IMT or core surgical training, they've completed the membership exam, but they've organized and delivered simulation teaching session for final year medical students. So that's a bit step ahead of just saying teaching session for students. And I'll come to that. Why is that important and why I've highlighted organized? Again, they have said that they completed an audit and they're presented. So not only did an audit, they completed an audit cycle and presented in the regional meeting. And they also mentioned about the QIP, which they've accepted for the poster presentation in the BSG. So that is almost the same information as candidate 1, but give us more into the personality of candidate 2 and more chance of them getting shortlisted. Reason I highlighted the organized part, because when I do the ES for the foundation year doctors, if you organize the teaching session over a 3-month period, it gives extra point when you're applying for the job for IMT posts. So, but if you've done a teaching session, that might not give you an extra point. So just keep it in mind when you start your training or something, get involved in organizing a teaching session. It can be the general club that you organized for your, like if you're working in respiratory, you organize the general club meetings for all of them, or you get in touch with your postgrad and involve in organizing a teaching session for final year students, or any other teaching session, and you organize them, and that will give you a certificate, and it will give you extra points when you apply for IMT post. A best example of CV. A lot of people, they ask me, what's the best template for the CV? Answer is there's no hard and fast rule. As I said, the CV is how you're selling yourself on the paper. The main thing is that it should be concise, it should be precise, and it should be you on the paper rather than just copying and pasting for anywhere from the web. CV keep evolving as you progress in your career, and CV change depending on the job you're applying. So when I started my applications in UK a few years back, quite a few years back, my CV was 6 pages. When I applied for my role as an honorary senior lecturer, it was an A4 size, one side of the CV. So in my honorary senior lecturer post, they were interested in my clinical skills. They were interested in what teaching that I've done and what's my managerial or leadership qualities that would help them to appoint me for their post. Same when you go for a research post, yeah, they need your clinical skills and information there, but they're more focused in what you understand about the research, why you are want to get involved in that sort of research purpose. So just think about it. If you are the person who will be shortlisting, what would you want to know about the person on the other side? August Wilson, one of the writers, he said, simply you say it, more eloquent. So less is sometimes more. Do's and don'ts in CV. So make sure it's concise and short, use of bullet points, focus on your achievement and awards. It should be in chronological order. And more importantly, it should have a personal touch to it. It shouldn't be long. Other day, I went through a CV which was 64 pages, so nobody would read 64 pages. Paragraphs does not give the same information in the bullet points, and they're not as powerful. You should not be overselling. Sometimes I've seen the CV saying, I've done plurosynthesis, thoracosynthesis, without supervision, but when you come to the ward or in an interview, you don't know the procedure. So don't oversell, but don't undersell yourself also. That's a more important bit. Like if you've done the teaching and you have achieved any award, just don't say that also I've got a gold medal and blah, blah, blah. Highlight that achievement and sell yourself. So don't oversell, don't undersell, but do sell yourself. Don't use abbreviations. Maybe they're different for, like if you use HSSC, nobody would know what HSSC means. So you have to be careful what you use and don't use generic phrases. Like I'm compassionate, caring, and this, everybody is. So you have to show yourself your own personal nature of why it makes you better than other candidates who have applied for the post to be shortlisted and to be called for the interview. So there's great power in words if you don't hitch too many of them together. So that's my, these are some pictures from area where I work and where I live. It's a beautiful place. If somebody is interested in hiking and going to waterfall walks, you're always welcome to come in and join us in South Wales. Thank you very much.
Thank you, Dr. Shanu. Dr. Naseem Maraj, if you want to take on for your next talk. There is a question if you want to.
We will answer question at the end.
That's okay.
Thank you. Just write down the question. Ask everyone to write down the question on the chat box, and then
Yes.
you can answer at the end, because we have really, and once again, thank you, Dr. Shanur, for an excellent presentation. And without a delay, I will hand over to Mr. Naseem Wright.
Thank you.
Assalamu alaikum, everyone. My name is Naseem Waraj. I've got lots of hats to introduce. I'm a consultant, collector, and general surgeon in NHS. I'm a senior academic tutor for University of Birmingham. I'm a supervisor, clinical as well as educational. I do lots of other hats within the NHS. I do CT interviews for the deanways. I do ST3 interviews nationally. Apart from that, I'm a trustees for Derbyshire Cricket County. I've been a chairman of one of the cricket club for 5 years. I'm one of the founding member of UPNE. I founded the sports section in the UPNE. I wrote first constitution of the UPNE, and I was the steering group member of the UPNE as well. So lots of contribution, extracurricular as well. So I hope I'm selling myself, not underselling or overselling, as Shanu Bhai has said. And I think, Shanurbai, I wish I had seen your presentation when I was applying for my job. It's very concise, very comprehensive, and valuable one. What I will do, I will just start showing my own personal CV to see if that helps you. And then I can give you some tips and tricks on those. Can you enable me to share it, please, if anybody is a host or co-host?
You are a co-host, Mr. Wright.
I can't share it.
Okay, let's check in 2 seconds.
Mr. Raj, I like to mention that you are live on Facebook. So if you want to share your personal CV, so I just like to alert you.
No, that's fine. I think we have deleted a few of things out of those anyway. So hopefully that should be all right.
Well, thank you very much.
So you are a co-host now, Mr. Wright. Can you not share it?
I cannot, boss. I can't.
There is this, okay. Can you send your CV to? Okay, let's try.
So I think the bottom line is, as Shanurbai has said, if you're sending your CV, make sure the CV is legible font. Should not be handwritten. I must say that I've seen one ST3 interview CV written by hand, which is not the right practice. Secondly, make sure the font is above 10, because most of the people like myself are around 50-year age and have got glasses on, and we can't read small fonts. Secondly, as Shanurbai said, there should not be too much on it. Very articulated, eloquent CV with the articulated personal statement. People won't have much time. My attention span is 15 seconds as a surgeon. So I may not be able to read more than 15 seconds if you have written full page. So it may be just affecting your shortlisting chances. Habib, if you can share from your computer, I don't mind.
Can you guys see it?
Yeah, okay. So the first page, I mean, as Shanurbai said, you're selling yourself. So you need to sell it correctly. And this CV is your introduction to the rest of the world. So next page. So you do have, I must give you a disclaimer that neither Mr. Shanur has seen my CV, neither have seen his presentation before. But you will see that my statement is exactly the same he's mentioning. So my details are there. There is no religion mentioned. There's no date of birth mentioned. We don't need that. Then your academic qualification, your medical, and like non-medical one. Particularly here in this country, there is a culture that if you have some extra degree or something else, that gives you extra points. Back home, people may do BSc, or people here do intercalated degrees. That gives you extra point in your CV or in your interviews. So if you have got any diploma, any degree, anywhere in any field, just write it, because that will give you extra marks. Don't hesitate, because sometimes we feel that it's not relevant. It is all relevant. So you must write something if you've done extra. I mean, let's say I've done MBA, and I used to write my MBA there. And then you must write your in a chronological order, like your like say MRCS or FRCS, followed by your MBBS, followed by your GCSE and all those things. And then you have to give your clinical experience either in the UK or overseas. So you need to write in a chronological order as is mentioned here in my dates. Carry on, please. Next page, next page, next page, next page, next page. And then I have written publications straight away, because here you get marks for your publications. And if you've done good publication, just keep writing it. Doesn't matter which journal it is. If it's a peer reviewed, it's brilliant. Next page, please. And if it's not peer reviewed, just keep writing it, because sometimes they just need to see what you have done or how you've done. Carry on. If you've done any book, any writing, anything, just write whatever you got. Abstracts you sent for, which has been accepted for any international, national just keep sending those abstract. I mean, keep writing those things which you have sent. Carry on, please. Carry on, carry on, carry on, carry on, carry on. And then presentation like international, carry on, then it'll be national, and then local regional. So you need to write, if you have done in your hospital, in your region, in your deanery, just write all those. And in a bullet point, as Shanrubai has mentioned. Followed by, if you've done in research or anything, just write those. Carry on, carry on, carry on. Audits, which is nowadays called QIP projects. So if you do have done it, please write it and make sure that you complete the loop. If you have just done one single audit and not completed the loop, you're not going to get full marks. If we have completed the audit, you will get full marks. Please go ahead. Go ahead, go ahead. And courses which you are attending and which are relevant. There's no need to write irrelevant courses because nobody looked at it. Carry on. Carry on. Carry on, carry on, carry on. So if you have got any honors, any achievements, you must write those. Carry on. And your teaching experience, wherever you have done, just write those, because teaching experience is very important and it holds extra marks for it. Carry on, please. Carry on. So this, where I'll just highlight to you, because this is my very old CV. What you need to do is, everybody which is applying for the job must, I mean, they are all qualified to apply for those jobs. What stands you out? What stands you out is your extra degree if you have done it, or your extracurricular activities. Majority of the time when I do STC interviews or CT interviews, I know everybody has done MRCS, I know everybody has done these jobs, I know everybody has got something published, but these are things which stands you out, like what you have done apart from your CV. And that's where majority of interviews are interested in, like how dynamic that person is, how interesting that person is. Can I have this person as my colleague in near future? Can I work with him or not? So these kind of things does matter. So if you have it, please do it. Carry on, please, Habib. And then again, same headings which Shanrubai has mentioned. As I said, it's my old CV, so I have to just write all those skills, computing and things like that. But you must mention your management and leadership roles which you have done. Thank you, Habib. You can stop it. And at the end of it becomes a personal statement and your references. Thanks, Habib. So,
you're welcome, Naseem.
Yeah, thank you so much, Habib. In general, what you need to, the bullet point which Shanrubai has mentioned in his presentation, please keep it like that and make sure that everything is in chronological order. My dates are on left side, my details are on the right side, and it was legible and it was very concise one, so people can read it, and people should read in a certain period of time. I think we are about to reach our time, but we can take some questions if you have any, Mirza Saab or Kamal Saab.
So first of all,
thank you, Dr.
Thank you so much.
Dr. Shanu.
Yeah, thank you so much, Hassan. Carry on, please.
Thank you, Dr. Habib. So thank you, Dr. Shanu, Dr. Varaj. It's been an excellent talk and insight into how the employers and the people who want to employ you want to look at your CV. Like Dr. Varaj said, I think the most important point is, Dr. Varaj mentioned, is that make your CV in short. They want to see you whether you are going to be the colleague in next 2 to 3 years. So do they want to see you with them? So obviously that's very important. So like-minded people want to get together with each other. That's the most important thing. Number one, we've got questions. First of all, do we have any questions? Let's see.
Yes, there is a question.
So, yeah.
So Dr. Shanu and Dr. Naseem Arai. So we have a question saying, can you please tell how to give organized example while supporting the information criteria?
So with the supporting criteria, do they mean to like if we look at job description, is it supporting from that point of view, or just to highlight, like if you, like if they are supporting, say, on an audit, how you support that you have done an audit cycle and things like that, you have to give information on that. Also, whether you are supporting evidence why you're suitable for that post, so that's where you have to go through the job description and the eligibility criteria, and you have to make sure that you highlight in your statement all those criteria, that if they say that MRCP or MRC is one of the essential criteria, you do mention in your statement that why you have that applied for that post and why you'd be the one who is suited for that. Again, in sometimes it is putting evidence of your teachings. That's where the teaching session in with the college university or university ad hoc formal teachings. And if you have any certificates from your postgraduate department, that's what you can attach with them. Again, if you have presented an audit in a meeting and you've got a certificate, you can provide that also as supporting evidence. So it's basically, it should be concise, but also like, say if I give you an example of audit, you should mention what was your role, it was a cycle completed, and what was the outcome, how did it change the practice. So that's what my view on that. If Dr. Raj want to add anything?
No, I think you're explained very well. The supporting information or criteria is you must read the job description. Okay, that's very important. Even for FY1, FY2, you must read it, what is involved. Like it involves ward work, it involves something else. If it's an academic job, if it's a research job, you must read the criteria and make sure that you fulfill that criteria. And then if you have got any course related to it, if you have done any workshop related to it, anything which are related to that particular essential criteria, you must write it. And as I said, sometimes you feel that something you have done in the past may not be relevant, but it may be highly relevant, which may not be for you. So supporting criteria should be correlated with the job description. And when you see the job description, there are two things. One is essential, one is desirable. So essential you must fulfill, otherwise you will not be shortlisted. Desirable, whichever you can write, will give you extra marks.
Okay, thank you. So there's another question, please. Yes.
Yeah, so I think Amir Hassan asked a question earlier. I'm not sure if it means the same. So it says that, can you please explain how should we write the supporting information section while applying for junior doctor jobs? So I hope that meant the same.
I think it's the same thing.
Yeah.
And Dr. Bright has mentioned is very clearly that you write down the essential desirable criteria, and that's how you're selling yourself on the paper, and just make sure that it's there for, because if they look at the person statement, they can go further and read just your application in detail, because there might be 400 people applying for one post, and that's what they look at into how you have described your fulfillment of the criteria that are required for that job. So it's very important that you go through job description before you fill in the job on track jobs or NHS jobs.
Okay, thank you. There's a question for Dr. Wright. Which portfolio should we use for surgical specialties? Is it NHS portfolio or IP, SBE, or Horus?
Right. I think it's a very important question. Depends on which level you're applying for. If you're applying for FY1 job or FY2 jobs, then you must go for Horus or NHS portfolio. If you're applying for higher jobs like CT job, ST jobs, then you must have a basic full criteria to fulfill. They want some sort of certification that you have got competencies for foundation year job. If that form has been signed by your consultant or your deanry, then yes, you can go ahead and apply for CT jobs. However, if in CT jobs or as well as in ST jobs, they want to see your logbook. And I don't think you can have a robust logbook in NHS portfolio or Horus. So you have to be ISCB. So I would recommend, if you are a surgical trainee, then use the ISCB at least for your logbook. But otherwise, it depends which level you're applying for. Does it answer the question?
Yeah, great. So the next question is, I can answer this. Should all our experience should be within 5 years, or more than 5 years, should we write that also? The question is, should we write our past 5 years experience or all the experience? So all the experience starting from your medical school, graduating from your medical school till the date. So that should be added to your CV or the portfolio. So it's not last 5 years. Some of the jobs when you apply, they will ask for the courses done in last 3 to 5 years. So that should be only the courses within 3 to 5 years. But the experience starts from the day you graduate from the medical school from the first job. So all the experience for the last 5 years. Next question is Sarmad Hassan. Is it worth applying to jobs in which we do not fulfill the essential criteria? Because these days they are asking for specialty exams for higher criteria for junior grade jobs as well. Thank you.
I think if you apply for a job that requires 4-year experience in UK, say for a medical registrar job, and if you haven't got that, you can apply for that, but you won't get shortlisted. So if you don't fulfill the essential criteria, the chances of you getting shortlisted for that post are quite minimal. So and that's where you have to look into, because if you're applying for, say, junior clinical fellow post, that is from the F1 to IMT3 level. And so that it covers a broader experience that you need. So that's what you have to specify, or you can check with HR that that's what your experiences are, and that's what you're applying for. So if you don't fulfill the essential criteria, in my experience, the chances of getting shortlisted for the job are almost negligible.
So I totally agree with Shanur Bhai. There is no harm in applying. You never know, if they are desperate, they may shortlist you. However, if you do not fulfill the essential criteria, don't keep your hopes very high, because you don't need to be disappointed about it. But there's no harm in applying. Sometimes they are desperate and they may take you, they may limit your role, but they can shortlist you sometimes if they're desperate.
Okay. Next question is Seemal Masood. If you are doing two jobs together, one being teaching and one being clinical, is it okay to mention both jobs? I think yes. The answer is you should mention both jobs, because obviously one job highlights your clinical and the other your teaching experience. So you should mention. The answer is you should mention. Next question is by Muhammad Hatim Niaz. If someone is doing a primary healthcare job like basic health units, government dispensaries, is that experience helpful, or experience should be in tertiary care hospitals?
I think you can mention that in your CV or thing, because just to highlight it, because if you don't mention it, it will be a gap in your career. So you can say that you have worked in a basic health unit, and you can just describe what your duties were and how did it help in your progression and things. So it's better to mention that rather than keeping it blank and it appears as a gap in your career.
I think it's very valid advice. You need to explain your roles in a way that you sell yourself properly. You tell them how important job it was, what were you doing. It was like GP level jobs, and what were your extreme responsibilities. And with the given circumstances where you don't have facilities, you have managed those things. So you need to make, you need to sell it in a way that, yes, the job you've done was a very important job.
And picking up on that, you might be leading the polio eradication program in your basic health unit, or women health program, so with the WHO or something. So it can come up with something like managerial leadership skills out of that BHU that you have been working in.
Just on that note, sorry, Hassan, just on that note, please do not ever write which you have not done. Okay, this is not acceptable. Please do not write anything if you have not done, just because there are lots of probity issues comes in, and probity is a kind of a crime in NHS. So please don't write something which you have not done.
And it would probably be correct. I give an example, anyone who's interviewing you, it's like, well, you know how to drive a car, a new driver sits with you, and the moment he just accelerates the car, you know he's a new driver or she is a new driver. So the interviews know what you have done, you haven't done. And So there's another question. Dr. Kamal, would you like to read?
Yeah, so it's a question from Ahmed Javed. He says that does medical officer job experience in a private hospital hold weightage?
In my opinion, nothing is wasted. Whatever you have worked in, even in a private hospital, if you again, it's how you put that in on the paper. You can say that you have worked in a private hospital while preparing for the PLAB examination, and you look at the elective surgical skills and things like that. So nothing is a waste. Like, I'm a physician, but I worked in urology. I still know how to put a 3-way catheter in and irrigate the catheter. So those are the things. So how you sell it. So nothing is waste, even if you've worked in a private hospital. It is your clinical, and you go through you learn the clinical skills and clinical experience. So it's better to mention that rather than placing a gap in your CV.
There's another
Thank you.
question from
Yeah, go ahead. Yes.
Amir Hassan. He says, can I sign my request form from a consultant in Pakistan who's a CCT from UK? I have just got GMC license and applying for jobs in UK.
I think the crest form is from your employer or the consultant who's working in UK, because they know the system of where you want to apply. So my advice would be that when you start your job in UK, that's when you can get your crest form, which is equivalent to the competencies that you're applying for, like IMT or F1, F2. Get it signed when you get your first job from the consultant that you're working in UK rather than from somebody in Pakistan. What's your opinion, Dr. Varach, on that?
So I think I absolutely agree with you. But however, these kind of my colleagues were, I mean, I was in the same shoes a few years ago. Sometimes it's difficult to get signed some here within certain limit of time. It's best thing if you write GMC and ask them directly. They are not there to catch you. They are there to help you. Even if you ring the hotline and ask them, they will help you straight away. And get them something in writing. If you phone them up, ask them to send you email in writing so that it is recorded for you. But I must suggest to contact them. Sometimes they say it's a CCT and you work there with the CCT person, they may accept it. And in this country, unless you ask, you will never get. So you must ask.
I will add one thing on this point to both of you. So thank you so much for providing this statement. As a consultant physician, sometimes people came across the different countries, Pakistan and India, especially, or other IMGs. I agree with you. The GMC is the other port, and secondly, you need to speak to your current education supervisor, so at least he can write sometime on your behalf to GMC. And then if he's happy and also GMC happy, then they can sign off the crest form, because some of the candidates just come when they're going to start their training post. They are just actually like 1 or 2 weeks away, so they're not going to get all the competency signed. But as Mr. Wright said, there's no harm to ask from GMC, but please keep in confidence with your supervisor, so at least he or she knows that what you're planning to do, rather than that they're going to have a surprise that GMC going to write them and they think that you can probably you are bypassing them basically.
Okay. Thank you, Dr. Habib. Thank you very much for your expert experience from the panel. The next question is it's difficult to get the audits and the QIPs and research in Pakistan. Oh, sorry, and overseas. We are APNI and specifically from Pakistan we're talking about. So the question number one, how to get that? And the second part of the question is, there are people who are doing paid researches. Should we do it?
The first part of the question, the audit and QIP, I think in Pakistan, you might have much more opportunities to do the QIP. But nobody does it there, and nobody might encourage you. So you might have to do it on your own, but there would be opportunities in Pakistan also. Like if I give you an example, it's a very small thing that you can do a QIP, like a handover of the patients from night team to the day team. You can do it's whatever you feel can help to improve the patient care. So there would be a lot of opportunities both in Pakistan and when you come to UK or any other country to do the QIP and audits. Again, it's not a tick box exercise. It's basically how you can improve the services for the patient care and things. With the paid research, what I understand is that if you're doing a research fellow job and you're getting paid for that, is that
no, I think Dr. Shenur, I think you got the question right, wrong. the question was, there are people who ask for money from you, and probably the fake research. The answer is, do not ever get that done. Do not ever get that done. That's all fake. If you're not part of research, you're not doing it, you'll be caught. That's probability. So do not do it. And I'll try to add on Dr. Raja Nadeem Sajjad on it. Dr. Raja, there's a lot I think people, our junior doctors, upcoming brilliant junior doctors, uh, we would like to do another webinar on quality improvement project and QIP and research, if it's that possible for you. And Dr. Habib, will you be happy to arrange that for us? Dr. Habib and Dr. Nadeem, please.
Thank you very much, Mirza Saab. First of all, thank you very much, Dr. Shanur and Dr. Naseem Raj, for giving talk on such an important topic, because I receive a lot of queries from our youngsters every day. So about their CV, how to write, what they should write and what they shouldn't write. And many of them, they forward their CVs or first job application to me. This is really very important topic. And thank you very much. I would request all of you that we should do this session maybe after 3 months, and we keep doing this one because new doctors are coming up. They're applying jobs in the UK, so they need to write down their CV in an appropriate form. Thank you very much, Hassan Mirza Saab. Thank you very much, Dr. Kamal, for moderating this session. Yes, I agree with all of you. We should do the second part, quality improvement part, maybe in August, if everyone agrees.
Jirasa, I'm going to just conclude a final thing, just a couple of things regarding the session. But I think in terms of August, I think is a really good idea. And as you said, this is a very important topic. We can actually discuss as our team and come forward with a plan for the junior doctor. But definitely we need to do a second session for that. And as you said, you received lots of queries. I received lots of queries for that. And on the chat box, some of the people also expressed to shows interest in terms of joining up regarding educational activities and all those things. So I probably forward these details to you, and you can contact them regarding to increase the membership and help them regarding these activities. In terms of, once again, thank you, Dr. Kawal and Dr. Hassan Mirza. You both actually are quite busy today, I know, regarding your commitment, but still you decided to come forward to help us. And once again, thank you to Dr. Shanur, who again, I haven't met you before, but definitely you are a really helpful person and very intelligent at the same time. It's really exciting talk, whatever you give it to us. I learned myself as well. And last but not the least, Mr. Naseem Rice, as an elder brother, he always ready to help us and actually came forward regarding his experience. So I'm going to hand over to him to conclude the session. And thank you once again, everyone, for joining today. And thank you once
Before
again,
we go
Dr.
to,
Nadeem as well.
thank you, Dr. Habib. Before everyone goes, there's a question constantly coming in. How do we join APNI? How do we join APNI? There's a lot of interest in joining APNI.
Mirza Sahab, can I interrupt? Sorry. So they can contact me. They can contact Habib Haider. They can contact Dr. Kamal. They can contact Naseem Wadaj. Any one of us, Mirza Sahab. So you guys contact with any one of us, and we will be very happy to guide you how to become a member.
Thank you.
Thank you. Thank you. So like I said, it's a democratic organization. This is coming from the top leadership themselves, that you can directly contact them. So such is the reachability of APNI, that you are being a junior doctor, you can directly reach to the general secretaries and the education lead and the executive members. So come and join us and reach out to us, and we'll be happy to take you forward. Over to Mr. Varaj.
Thank you so much, Hassan. Thank you so much. I will not take much time. So the last question, which was answered by Shanur Bhai, if you've not been involved in any audit back home, please try to do it here. If you are here, even during your attachment, you can do it. So I wouldn't recommend to write anything where you are not part of it, or a paid is not acceptable at all. It's not your research, it's somebody else who's doing it. So don't do it. You'll be in deep trouble if you do it. I think in conclusion, I can say that for me, it was very helpful and eye-opening as well. We have got our next session from education section point of view is GP training at first jobs in the UK and the challenges. It's on 30th of July at 11 a.m. So we recommend that if you are interested in GP jobs, please do come and join and listen from the people who are already doing those jobs. And as we mentioned that in August, we will be holding the interview skills seminar, where we will be answering the question which you asked in the interviews and give you some tips and tricks on it. That's on 6th of August, and please watch out for the poster. I don't think I've missed anything else. Thank you ever so much from my side, please. And if any question, you can join our WhatsApp group. You can go on our website, you can go on our Facebook page. So there are lots of ways to contact us. Thank you.